Hey, wellness warriors! Did you know your breath holds the key to a calmer, healthier you? Join me on Pure Rehab Yoga, where we are unlocking the magic of breathing to lower blood pressure. Discover two quick techniques backed by science that can transform your well being in 5 minutes a day. Ready to join the transformation? Hit that subscribe button and welcome to a breath of fresh air on Pure Rehab Yoga, where every breath counts. Welcome to Pure Rehab Yoga community. I'm Dr. Preeti, and in today's episode, we are diving deep into our core of our existence, breathing, or scientifically known as respiration. We will explore two unique methods to lower blood pressure, potentially save lives, and fight against flu or infection. So grab a seat, take a deep breath, and let's explore the fascinating world of respiration. First thing first, what is respiration? It's more than just breathing. It's the intricate process our bodies use to exchange gases like oxygen and carbon dioxide. Think of it like an engine that keeps the human machine running. As we inhale and exhale, diaphragm, the unsung hero of this process, it's the most underappreciated muscle of respiration. It comes and plays a role. It sits right below the lungs. So as we inhale, it pushes down, opening more space in our lungs for the air to come in. And as we exhale, it goes out, so the air goes out of the body. Isn't it so cool? Tangent to this topic is nose breathing. There's a lot of controversies, a lot of conversation, a lot of topic between nose breathing and mouth breathing. But I would like to tell you how important nose breathing is. Nose breathing isn't just about etiquette, it's a game changer for your health. It promotes optimal oxygen exchange, it boosts nitric oxide production, and it engages diaphragm for efficient breathing. Let's talk about normal breathing rates in human beings. On average, adult respiration or breath rate is 12 to 20 breaths per minute. So anything under 12 or over 20 is concerning and maybe a sign of underlying health condition. Definitely needs more attention. Did you know that your breathing habits can impact your blood pressure? Research suggests that slow, deep breathing can lower blood pressure. So if you're looking to learn more natural ways for improving your cardiovascular health, stick around. So you would ask, what's normal blood pressure or a healthy blood pressure? 120 over 80 millimeters of mercury is considered a normal blood pressure on a consistent basis. Anything from 120 to 129 is known as elevated blood pressure. This is where doctors always tell you to do lifestyle modifications or breathing exercises, and this is a great place to have a reversible or going back to where a normal healthy blood pressure is considered to be possible. Anyone with stage 1 hypertension is 130 to 139. This is where, based on other comorbidities that you have, maybe it's genetic or it's in your family that people have had high blood pressure, or you have other medical conditions that could support you being on that high blood pressure range, is when the doctor advises you with either medication or may just be lifestyle changes or breathing exercises. So today's technique, you will learn different ways where you can work on elevated blood pressure, or maybe sometimes stage 1 hypertension, to reverse completely. There's numerous studies done by Harvard. And in the last 5 years, there has been 17 research articles published which supports these breathing techniques. First technique is called 4-7-8 breathing technique. 4-7-8 breathing technique. 4 seconds of inhale, 7 seconds of hold, and 8 seconds of exhale. It's as simple as it sounds. What is important is consistency. If you did that on a consistent basis every day for at least 30 seconds to 1 minute, you will start noticing the changes. Now, life story about this technique and how it helped one of my patients, and I think potentially save his life, because that made me stop the session and actually work on his blood pressure with the breathing exercises rather than doing physical therapy session on him. So his height, or the systolic number on the top level, was 180 on arrival, and using this technique for 5 minutes, just 5 minutes, lowered it to 140. And this is how effective this technique is. The second technique is an extension of this technique. For some people who don't have a good practice, they can start doing a 4-8 technique So it's 4 seconds of inhale and trying to exhale all that carbon dioxide out of your body with a longer exhale. Because if you're not someone who uses the nose or nostrils to breathe all the time, if you're having difficulty with the retention, 4 and 8 technique could be an easy one to start. So try these techniques today and let me know in the comments below how you did. If you already haven't, subscribe to the channel and like this video if you enjoyed or think you gained something from it. Hope you all find peace.